Hi, I'm Marcia Johnson with Franciscan Physician Network. I practice in the field of rheumatology. I decided to pursue a career in the healthcare field to help people improve their clinical condition and to use science as a basis for that. Well, rheumatology is actually sort of a broad field. There are many types of arthritis. There are what are called inflammatory types of arthritis, such as rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis. Also in rheumatology, there is osteoarthritis, and sometimes fibromyalgia falls under that, sometimes it does not. So it's actually fairly diverse. In it, you also see people with what's called vasculitis, which is inflammation of blood vessels, which can be quite serious, but there are definitely treatments for it now. And of course, lupus, which we definitely see a lot of lupus patients. And finally, after many years, there have been some newer medications approved for lupus. I think one thing is to listen to what the patient tells you. Everyone knows their body better than anybody else. Listen to their history, even if they've been labeled with a diagnosis, keep an open mind. If they tell you things that don't match that, look into it. And to try to work within their preferences to a point. If they want something that is an injectable drug, if that's appropriate, fine. Because sometimes there's more than one way to solve a problem. I love it when people come in with significant problems and we can do a lot to help them. Sometimes it's easy, just the right medication and they do vastly better. Other people are more challenging, where you have to find out what they can tolerate, what works for them, what their insurance will cover, which is an issue these days, and to try to put the combination together. I've had patients where I had one patient in her late 20s who couldn't even dress herself in the morning because her rheumatoid arthritis was so bad. Her boyfriend would help her out. And by finding the right combination of medications, she went completely in remission, married the boyfriend, working on a master's degree last I talked to her, had a daughter. So her clinical condition improved so much from where she started out at. And that's not a rare scenario. Or I've had patients where they were labeled with fibromyalgia. And they might have fibromyalgia, but when you talk to them, you find out also they have back stiffness. They have a positive marker for spondylitis. You put them on medication for that, and they do immensely better. Well, I enjoy reading. My mother was a town librarian growing up. Gardening, I'm not very good at it, but trying to get better. And we have deer, which is an issue. And we have a lot of parks near us, so I like to get outside when the weather permits. One piece of advice I give my patients is to let me know if they have certain preferences or concerns about medications, so that we try to find the best medication for them, and that we also don't try to get a medication approved that they really would rather not use.